People get addicted to different things: drugs, injection, smokes, cough syrup. Recently, I even heard people started getting addicted to dynamo gin. A science student, well done. I mean, my last video, I talked about people getting addicted to alcohol and consuming alcohol a lot, and I got a lot of responses. And in this video, I want us to discuss something different, another concerning thing about what people are getting addicted to: painkillers. I mean, a lot of young people get addicted to different painkillers: tramadol, diclofenac, oxycodone, felvine. At the end of this video, I'm going to talk about other type of addictions too, but let's get straight into this particular one. Yeah. So when I say painkiller addiction, it means like when you take painkillers excessively. There are some conditions that occur that you need to take painkillers. Like normally you are ill and you take painkillers. But then in some people, when the pain is over, then they still have the urge to keep taking the painkillers, and then that leads to some form of addiction, and then they really can't do without it. Yeah, I've seen people who had kidney stones who took painkillers for kidney stones and then got hooked on it. I've seen some people who have some form of a blood problem and blood disorders, and then they start taking painkillers and then they get hooked on it. And then the end of it all usually leads to organ damage. One of the craziest things that can happen in the immediate, apart from the highness you get from it, it can lead to some very bad respiratory depression where you start to have problems breathing. Drugs like morphine, drugs like codeine, generally opioids, tramadol. When you use them, then they can cause some level of respiratory depression, which you should be really be aware of, because they will cause some damage in your body, and then you really won't know how bad it is until it's almost that time. It can also cause some form of organ damage. I've seen people who had liver problems from overuse of paracetamol. I keep saying that every drug has its own side effects. When people say, "Oh, doctor, you gave me this drug. What's the side effect?" I didn't use it because I googled the side effects. I tell them, even paracetamol has side effects. If you Google it and you see it, you will not even use it. So every drug has those side effects. And I've seen people having organ damages, especially liver damage, from excessive use of paracetamol. Because when you take a high dose, as in my last video, I explained how the liver works. It keeps detoxifying, getting injured, healing, and leaving scars. Those scars become fibrous, they become cirrhosis, and they lead to liver cancer. Also, in the short term, overuse of painkillers can cause some gastrointestinal problems like bleeding, like people that have ulcers. Different things can cause ulcers, but one of the commonest things that cause it is overuse of what we call NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. Overuse of them, e.g. diclofenac, ibuprofen, felvine, overuse of them will give you bleeding. I've seen a lot of people that when they come to the hospital, "Oh, doctor, I'm stooling blood." Say, "Oh," and we ask some other questions, and we come down to how much painkillers do you say? "Oh, doctor, every night when I get home, I take painkillers or else I can't sleep." I mean, so painkiller dependence, painkiller addiction will most likely give you what we call a peptic ulcer, and then give you some gastrointestinal bleeding, and then who knows? And this bleeding can be bad. I've seen people who take this drug and it led to some form of bleeding that they almost did not recover from. It took a lot for them to recover from it. Also, heart issues can also occur when you overuse these painkillers. Of course, directly causing heart attacks. And then when there is a lot of these drugs in your body, excessive use of these drugs, especially NSAIDs and some opioids, excessive use of them, getting into the blood, getting into the heart can't take it anymore, goes into some form of attack. That's also something you don't really want to be in that space. Trust me. Long-term consequences that can happen: kidney damage, as I said, dependency and addiction. On this dependency and addiction, I must say, there's a way these drugs work, just like every other drug that you get addicted to. When the doctor prescribes one tablet to use morning and night, then because of the euphoria you get from it, you're happy, you don't want to use one tablet. Then after a while, keep using them because of the euphoria, but then you now realize that one tablet is not enough. Then you increase to 2 tablets, then 3 tablets. Then I've seen people take as much as 400 milligrams of tramadol once. Of course, this guy had a massive heart attack and passed. 400 milligrams of tramadol. And then I've seen people also take what we call an injectable form of painkiller called pentazocine. Pentazocine, it's a very strong painkiller, but also has this euphoric, sleepy side effect of it. So people that abuse it, they love it. So they move from 1 vial to 2 vials to 3 vials. Some people end up using all their money, all their savings, all their salary to buy this drug. And that's how bad, that's the level of craziness it has. You can see. I've seen people die from this. I've seen people die from these things. Trust me, and it's not something good. It's something we need to really talk about and put word out there to show how drug dependency, drug addiction can cause a lot of harm and death to people in this age bracket. I mean, the youth, Also, there are mental health challenges attached to it. Anxiety, depression, mood swing. When you don't have money to buy a drug, you are unhappy. You want to buy this drug, but you don't have money, so you're unhappy. But the moment you get the money, you want to go and buy it, and it takes you to the euphoria level. After a while, the euphoria comes down, you get depressed again. So there's this mood swing that really occurs when you use these painkillers, and it's attached to being dependent. Another important thing is drug interaction. Some drugs should not be used with some other things. Like, I had friends who used to take a lot of alcohol. Then they will ask me that, doctor, this night, I want to take beer this night. Can I still take antibiotics? I want to take beer this night. Can I still take painkiller? Those things do not match. If you're taking any medication, do well to yourself not to take any anything other than water and food. If you're taking any medication, the risk of alcohol, the risk of drug dependency, the risk of smoking cannot be over or underemphasized. It's just important for you to just stay true to your medication and don't divert. Don't use anything while you are, don't drink or smoke anything while you are on your medication. And for some people who get some signs of overdose, there are some things you should watch out for. When there's an overdose, what am I to watch out for? Some people start having shallow breathing, especially people who overdose on opioids like fentanyl, morphine, codeine. When they overdose on it, they start having some shallow breathing. Some experience drowsiness, even some get into loss of consciousness. There's a lot of nausea, there's a lot of vomiting and abdominal cramps that comes when you use overdose of paracetamol and also overdose of NSAIDs. Some people go as far as having seizures. Overdose of tramadol is associated with some form of seizures. And then blue lips and blue fingertips. When you start having blue lips and blue fingertips, it means the body is not getting as much oxygen that it is supposed to get. And then, trust me, in any form of overdose that you find yourself, in any form, any type, anywhere you find yourself getting overdosed on drug, maybe mistakenly or knowingly, get yourself to the hospital. Get yourself to the hospital. There's no point trying to wait it out or see it through. I had a patient who was reusing needles for his pentazocine, was injecting himself pentazocine, and he ran out of needles. So he was reusing the needles and then infected himself with tetanus. And he went online to check what he can use to treat tetanus, because he didn't want to go to the hospital. So he went online, saw some medication that he can use to treat tetanus. He went to the pharmacy. I don't know, he got the medication and came to inject it and was injecting himself even in the house. Of course, he passed. He passed because at that point when he was found, there was no point, there was no return. But it's very important to prevent all this. And how can you do that? Let's assume that you are overdosing unknowingly. Always follow prescribed dosage. Whatever is prescribed, follow it. Avoid mixing painkillers and alcohol or antibiotics and alcohol. Avoid it totally. Consult healthcare professional before using multiple medication. If you know you have about 3 or 4 medications that you want to use, make sure you talk to a doctor. To say, okay, look at these drugs. Can I use them together? I'm not sure. Or go back to the doctor who prescribed this medication and get proper clarification, or a pharmacy and get proper clarification before delving into using these drugs. On the final note, I need to put this out there, that there are some people who do not overdose on this medication, but they abuse them. Some people abuse painkillers, some people abuse antibiotics, ampiclox, ciprotab. Some people abuse them a lot. In fact, amoxil. You see people say, I want to flush my system, that's why I went to take ampiclox. I want to flush my system, that's why I want to take ciprotab. I had a patient recently who wanted to flush his system too, and he got down with a serious side effect of using Zil. Yeah, serious side effect of it. He started having, his skin started peeling, and I told him, have you used this drug before? Yes, and it has sensitized you. That sensitivity now you are using it again, then it's going to react. If you use it again the third time, it's going to react real bad. So be sure that whenever you are using any medication, it's a medication you need at that time. The medication you need at that time, not the medication you feel like needing. No, let there be a symptom, let there be a reason why you use any medication whatsoever. If you have any recommendation, please put it in the comment section. If you have any suggestion, please put it in the comment section. I'll see you again next time. Take care of yourself. Bye.